Hello, everyone, and welcome to our Facebook Live Parenting Series. My name is Dr. Lisa Konick. I am a clinical psychologist and owner of Konick and Associates, which is a family behavioral health center in South Naperville and Orland Park. And we started this parenting series today. It's called Help My Kids Are Going Crazy. It is for parents to give you tips and resources and offer some support from area experts in psychology, behavior. We have Maggie Lord here today, who's an occupational therapist, who will be speaking to you about sensory processing. And we started this series to help you during this time of social distancing. A lot of our clients have been asking us for additional resources and input because their children are struggling with the ongoing shelter and that lack of support and lack of cohesion and closure to the end of the school year. So we're here to give you some supports. I'm going to introduce Maggie today. Maggie Lord is an occupational therapist and the clinic director at BDI Playhouse Children's Therapy. And Maggie, you can tell us where your offices are located once I finish introducing you. She's going to be talking to us today and providing tips for managing behavior and sensory overload. So a lot of you might be realizing your kids are sensorily dysregulated, is what we call it, and they're all over the place. So Maggie is the clinical director in OT. She has a bachelor's degree in interdisciplinary health from the University of Illinois, Urbana-Champaign, and a master's degree from University of Southern California in occupational therapy. In her free time, Maggie enjoys spending time with family and friends, traveling and soaking in the outdoors, which we're all getting a nice wave of right now that the weather is blooming. She practices both in the clinic and aquatic settings for children with a variety of ages and abilities, with specializations in sensory integration strategies, ocular motor and visual rehabilitation strategies, picky eating and problem feeding, infant massage and aquatic therapy. Maggie strives to make BDI a place where play and learning come together in a creative way to help kids grow and gain independence in the activities that are most important to them and their families. Thank you, Maggie, for joining us today.
Thanks for having me.
Tell us a little bit about your clinic.
Of course. So I work for BDI Playhouse Children's Therapy. It's also just known as BDI. We have clinics in Aurora and in Orland Park. And we have OT, PT, and speech therapy at both locations. We see children who from newborn through 22 years old. And we love our families. We make a really strong point at BDI of really welcoming in those that we work with and really trying to become a member of the families team. So that's really important to us.
And we've been to your clinic. You have a lovely clinic. One of the things that we were talking about, and I know our families are interested in hearing, is they need some tips and strategies. And as a clinical psychologist, we do a lot of behavioral management, behavioral support, parent coaching, and really helping parents learn how to help manage their kids' behaviors and learn how to read those. But with all of these changes in place, our younger kiddos especially are very dysregulated. We work with a lot of kids on the autistic spectrum with special needs, sensory integration disorder, as well as ADHD. And a lot of our parents and our families are saying, help, we need some ideas. So I imagine that you're seeing some of the same challenges at your practice, and it's a little different format to be providing these therapies through virtual means. So can you speak a bit about some of what sensory integration means and the sensory integration disorder and what you are doing to support some of your families and giving them some tips while they are managing during the shelter?
Sure, can do. So let's start with what sensory processing is. So sensory processing in a blanket statement means being able to take in the information around you from your environment through your different sensory systems, being able to process it appropriately and accurately in your brain, and then being able to form a response to that sensory input, which is appropriate. So we have a lot of kids who we work with very closely who have some kind of breakdown in one or many of these areas. So some kids have a hard time reading the information in the first place. Other children might have a hard time picking the appropriate response to what's going on. So we have some kids who never hear their parent calling to them from a room away because they're not registering that information. We have other kids that hear that and throw a big tantrum because their response is not appropriate or was not processed appropriately. So we address where is the breakdown and how can we support this child to help the process go more smoothly so that ultimately we can get through the day in a way that's really manageable. So all of these areas are really highly impacted by what's going on right now with being in quarantine, having to socially distance, and having immense routine changes. And so all of our families are starting to really feel an increase in some of these inappropriate responses as a result of the sensory system just being put under additional stress. Whenever any part of our environment is adjusted, we as a person have to find adjustment as well. But not all of our kids have found the ability to make those adjustments. And so that's where some of these tips are going to come in handy so that our families are seeing much less of some of the agitation that their kids might be displaying. For example, we're seeing some kids that are very suddenly seeming to be very sensitive to sounds in the environment that they weren't really sensitive to before. We have other kids who are the parents are noticing that they really cannot wear clothing that is tight or have tags on them. We have other children who are having big meltdowns because they were asked to come to the table for dinner or something that they're asked to do every day and is not normally an issue, but our kids and our families are finding that because of the added stress that's going on in their life, that's just too much right now, and their system can't process and handle it accurately. So those are some of the things that our families are seeing: increased meltdowns, increased sensitivities, all as a result of our families and the children feeling stressed out. So do you want me to just run through some of these strategies?
Our people are asking for tips, Maggie. Give us some ideas. What can they do to help? And I know we've talked about, I guess I would think about it from two different kind of branches. One is the behavioral regulation, because kids are pacing and they feel just kind of not in control of their bodies right now. And I think that leads to some outbursts because they just don't feel right in their bodies, and their ability to run off some of that steam has been shifted. Like a lot of the families that we work with go to the pool all summer. Well, a lot of the community pools are closed. So they're not in the playgrounds and the parks, and the ability to connect with other kids and run around. Families are trying to figure out different ways to manage those behavioral needs.
Yeah.
The other piece that we're seeing are just emotional meltdowns as a response, like you said, to minor requests. Mm-hmm. And those emotional, I talk about big reactions to little problems. And we're seeing a lot more of that. So that emotional component.
Exactly. And that is all tied into how is the sensory system feeling at baseline. And right now, baseline for the kids needs something totally different than it did a few months ago because they're still trying to work through some of these changes, some of these adjusted expectations. So I'm gonna go through a bunch of strategies right now with you guys. If any questions come up or clarification is needed, please just let me know. You can either post in the box, or Lisa, you can let me know. I want to preface all this with the fact that sensory processing is very complex and it is different for everybody. Everybody is a little bit different. So I'm going to give you a bunch of strategies that work for most people. However, these are not going to be the end all be all or the definite solution for every child or for every family. So just keep that in mind as I run through it. I'm going to talk about some of these in reference first to that movement, because that's something we're seeing a lot of, is our kids are not getting their usual movement input. And as a result, their bodies are very agitated, they're very stressed, and they are pacing. The kids are acting out, and they're not really sure how to get the sensory information they're used to getting and they're comfortable getting. So some of the ways that I really suggest that our families do help with the sensory processing, the sensory integration, is doing some of these things preemptively to set the sensory system up to be ready for the day. Movement is a great way to get this. So we recommend doing a lot of yoga because that muscle contraction and holding those muscles in a certain position is really great on our proprioceptive system, which tells our body, here I am, and here's how I work. And it also feels really good input to our joints, which we get from both crashing our joints into something like stomping on the floor. It's a great way to get some quick input. Also, the muscle pulling on the bones and the tendons gives a little bit of extra input as well, which is why yoga or holding those movements is really encouraged for our families. So working yoga into the beginning of the day or the afternoon or just before that time of the day that's really tricky for our families to get through, usually right before dinner, is a good time to work some of this in. Stomping.
And just to add, I think it's probably very helpful for parents because I notice with parents trying to work from home, this is a great thing for them to do together, and parents can get a little stress reduction from it too.
Absolutely. I'm not going to pretend like I don't also benefit when I'm doing yoga with my kids because my body's getting something it needs, which I tend to overlook as well. Other things that work really well is, generally speaking, we call it heavy work. But for the same reason that some adults get really stressed out and they go to the gym and lift weights, well, I'm not that person. It works for a lot of people. Mm-hmm. The same concept applies to kids. So that heavy pulling and pushing is really, really great to kind of calm the sensory system and get everything organized. So what you can have your kids do is in the beginning of the day, in the middle of the day, again, before you're hitting those times of the day where you're just ready to pull your hair out because your kids are just unable to handle what's going on. We encourage maybe filling a grocery bag full of something heavy and asking your kid to move it to a different room. And the next day, move it to a different room. It can be something as simple as quick as that. Other times I'll recommend have your child rearrange the chairs around the kitchen table. It doesn't take that long as you're okay with the chairs being all mixed up. That heavy pushing, heavy work is fabulous. If you have a laundry basket, filling that laundry basket with a couple of heavier items, you can have your kids collect all their stuffed animals and put it in the laundry basket. You can even leave the laundry right in there. If you have your kids take that laundry basket and push it across the room and then push it back across or pull it across or tie a jump rope to it and use hand over hand and do some heavy work pulling, all of that work is so beneficial for their bodies and it keeps them busy. So it's also a task you can have them doing throughout the day. You can also have them doing things like vacuuming, pushing a vacuum. If you can convince them, it's really helpful that they're helping cleaning. It gives them a lot of purpose, but also they're getting that heavy pushing work that their body is really looking for. It's very organizing. Carrying anything heavy.
Helping with chores is also beneficial to parents.
That's
so tying things together might be helpful.
It just keeps everyone a little bit more together if we're doing our chores all together. And some of that can include washing windows. That's a lot of work for the body, but it's also great to have clean windows. So we can kind of find the balance with the parents between that. Some kids need this movement to be very, very playful. And some kids need their parents to guide them through some of these movements, which is okay if you're finding that you're having the time. Other things that we will recommend is doing different animal walks. So bear walk, crab walk, frog jump, bunny hop, anything that's going to keep their body moving and do some of that shifting is really, really beneficial for the system. So if you can't be around to instruct your kid each animal walk you'd like them to do, you can have them do puzzle pieces and go back and forth, just doing one single animal walk. You can have them draw pictures so they can pick from a jar or a cup or whatever you have them working on. Any of that is great, really great work for the kids. There is another sensory strategy that I recommend to many of my families with kids who are definitely experiencing some of the sensory processing challenges. And both your proprioceptive and your vestibular or movement sensory input are hit with this one really simple task. So I'm going to show you. I'm going to grab my little doggy to show you. But unscientifically, it's called the wiggle jiggles. And it's very, very easy. I'm going to push you back for a second. All you will do is have your child lay down on their back. And you can sit on the floor with them, or you can do this on the bed. And you grab their feet kind of around their ankles, and you just wiggle their body up and down. Now, my dog is not very heavy, so this is not very, very exhausting for me. However, this can be kind of tiring for parents. But this shifting, and the kid can request, I want it faster or slower, I want it harder or softer. But this movement is so great because it puts that pressure input through the joints all the way up the legs, all the way up the spine. And the added benefit of this is that our kids, their heads will tip. If you're doing it correctly, their heads will tip as you're pushing. And that tipping stimulates their vestibular system in a calming way. So I kind of equate it to jumping on a trampoline, but slower, which is more organized. So that movement, and some kids only prefer, if they're really sensitive to movement, really only prefer to do that for a couple seconds. Others would prefer that you do it all day long. So kind of run with what's going to work for you. For a lot of kids, it makes them very tired, and you'll see yawning very quickly after you do something like this. So just keep that in mind. Maybe that would be a great one to help them fall asleep at night if they're feeling a little agitated from something like that.
That brings me to think about bedtime routine, Maggie. That's one of the questions we've been getting a lot lately. Is their kids that are typically able to manage the bedtime process have been really dysregulated and oppositional at bedtime. Okay. I know we talk about structure and having a structured routine, but are there particular strategies when you've got children who are overstimulated or hyperstimulated, kind of right at that bedtime? I know the schedules are off, but what might be a sensory strategy that sounds like a good one that might be an option.
Yeah.
Do you have another suggestion?
We have a lot of work that we do with we call it sleep hygiene. But some of the ones that just kind of come right off the top of my head include shutting down screen time as early as you can, so that and eliminating the blue light when you can in the evenings. Adding a warm bath, if that's not too exciting for your child, adding a warm bath, having scented oils around, the calming ones like lavender or vanilla around in the space, going through the same routine, like you said, every night, having the same expectations. We're hearing a lot of kids having a hard time transitioning away from whatever it was that was really exciting to then go to sleep. So using things like the visual timers, the countdowns can be really helpful. Adding in a little bit of massage. That doesn't mean it has to be a full body massage, but if you get some lotion and do some hand rubbing or feet rubbing, anything that will be some kind of massage, deep pressure to the joints and to the skin will be really calming before bedtime. Making sure the lights are low, having any kind of white noise sound machine on as you're going through the bedtime routine, not just when you're trying to fall asleep. All of those things can be really, really helpful to get the kids' systems calming down.
Great. And I want to be mindful of the time. One of the questions that we've had a lot of from our families is emotion regulation strategies. Can you speak to some of those, Maggie?
Absolutely. So, and some of these you may have already hit on a little bit in your talk, Lisa, but for as far as emotional regulation, we really like to start for our kids with identifying what is the emotion you're feeling, where are you feeling it in your body, and bringing in some of the body awareness components. And then we ask our kids to turn to some of the strategies that they know are helpful. And some of the other ones might include using a tactile sensory bin with rice and beans, or playing quiet music in the background, or looking at a favorite book. So we really encourage for emotional regulation for kids to have the opportunity to go to their own space and use whatever strategies that we're finding either together or you were finding on your own as a parent is really helpful for them. But those emotions are running high when the system is really stressed, and that comes, so all the sensory regulation strategies will only be helpful towards emotional regulation as well.
One of the things that we tend to do in our practice that really complements, I think, some of the OT regimens that families get is we talk about that sensory decompression that sometimes kids need. And we think about that like when your kids are really ramped up. And a lot of times this happens right around play dates or when family is visiting, where there's too much input and kids seem to be fleeing. And we talk about maybe doing, a tent in the room where they have their quiet cubby space with some regulation strategies in there. I've had kids create camp out rooms with tented spaces in the corners or in the closets, and they kind of call that their people break. And we kind of plan those sensory breaks with some of these strategies. So I wonder if parents might be thinking about times of the day that their kids kind of need that break from sensory input.
Absolutely. Absolutely. We always encourage them having a space to go to when they feel like they are getting too agitated or they just need a break. We also encourage in those spaces, sometimes we'll have a bag that has the sensory, like the squeezy toys that the child likes to use to calm down, or the different flashlights that the child may really prefer. We also really encourage to have some kind of reset activity there for emotional regulation. So our reset activities are those activities that are very simple for the child, and they're very organizing, and they have a clear beginning and end. And that's something that we could work with a family to figure out, do you need more assistance finding what these activities might be? But they're the really concrete activities like the Legos or working with rubber bands or something where they can be sorting. Those things tend to be really great for use in a time when they are needing some of that space.
Right. I'm not seeing any questions. I want to welcome people to post questions. And if you are watching the recorded version, please post them and either Maggie or I will be happy to get back to you. But the other thing that came to mind was, the idea that sometimes parents don't necessarily know which sensory behavioral management strategy goes with their child because they may be giving the wrong input for the wrong need. Can you speak to the assessment process if parents have a question about this and they're starting to think about, maybe my kid does have some sensory issues that I didn't realize? What would be a process that they would go through to get this evaluated?
That is a great question. So for our parents who are starting to notice that their child is struggling with any of these areas, we would encourage them to reach out to our office, and we offer free screenings where we have the child come in and we just hear from the parent what is going on. And then we can kind of start to assess, does this child need further evaluation, where we can make a treatment plan and really help break down what those areas look like? Or can we give you a few strategies and let you kind of work through that just from what we've heard just in a half-hour screening time? So first, we usually begin with the screening. During the evaluation, we're allowed to do formal testing, which might involve the parent filling out a sensory profile, which really helps us break down which areas do what for this specific child, and then we use that to create a plan of how do we engage the strong sensory areas to help kind of even out the areas that are weaker, and how do we build up the weaker sensory processing areas. We do a lot of work with ABC charts, the antecedent, the before, during, and after, if we're looking at really specific behaviors. But we also do a lot of background work with the parents to find out, is it a time of day that's challenging? Is it a type of activity that is challenging? What is it that's really causing the sensory system to have the most challenging time? And how can we make adjustments so that the day goes a little bit more smoothly for everybody?
Great. And then the other thing that comes to mind, Maggie, is some kids are getting some OT at school. And how does that relate to some of the things you do as an outside provider? Because I know a lot of our families have both and really do need both.
Mm-hmm. So the school OTs, and I can only speak from my experience, I've only worked in clinics, but from what I'm hearing, the school OTs are incredible at finding ways for their kids to be able to remain in a sensory calm position while they're at school. So they're really working with the teachers to make sure that the kids are able to pay attention and they're able to listen and follow directions while they're in the classroom. And then that is complemented by what we're suggesting at school, which also, or at home, which applies also to school. Sensory strategies that work in all settings. So we help really build out upon whatever is happening at school to make sure that all of that is really carrying over well at home, and the sensory struggles that this child is feeling aren't really impacting as greatly things like getting dressed, eating food, falling asleep, socializing with my friends, paying attention when I'm doing homework, or being able to manage some of those at-home activities.
I have seen that be a value to have. The sensory environments are different in these settings as well. So that's important that we kind of look at some of the kiddos that we work with to see, make sure their sensory needs are getting met in various settings. We do have a question that's been posted, Maggie. I'm going to read this to you. Any recommendations for an 8-year-old who has been showing increasing signs of SPD, I assume sensory processing disorder, and anxiety, which is not necessarily diagnosed, especially in regards to sounds like the vacuum? She doesn't want to wear her brother's headphones. She also has been in quarantine with a high anxiety SPD brother. So sounds like sound auditory stressors.
Yes. So what we recommend with the auditory processing system, it's, again, it depends on the child, but if she's not going to wear the headphones, it might be because they're uncomfortable. And so some immediate strategies that you can do is have her be somewhere else while you're doing the vacuuming. But we recommend working through a lot of graded introduction to that sound. So having her be in the basement at first while you're vacuuming. And then maybe the following week, having her one level up while you're vacuuming all the way upstairs, and slowly decreasing the space. So the sound is getting louder, but more safely, because it's gradual rather than just, oh, I'm vacuuming in this room, either stay or go, and right. Just be mindful. We are seeing a lot of sensory preferences from one sibling hop right on over to the other as we're all spending more time together, because the children are noticing the response that their sibling is giving, and they're taking that as a cue of how I should be responding. So sometimes just having a very distinct conversation with the child and noting, here's how it is appropriate to respond, and here's what we're going to be moving towards as we're working with the sound of the vacuum or the blender or the hair dryer, whatever it may be for that child. But coming in for a screening is probably the best way for me to give a really detailed response on that. But that's a great question.
It is a good question. Now we're kind of closing the end of our time. How can families, and we'll put this on the page too, how can families reach you, Maggie, if they have additional questions or they want to schedule a time to come in to see one of your clinicians?
Absolutely. So our website has been revamped and we are ready for viewing. So the website is the easiest way to get a hold of us right now. It has our phone number. It has links to everything that you might have questions about. And there's a button of how to contact us and get a screening set up on almost every page. So if you go to bdiplayhouse.com, that's how you'll reach out to us. Otherwise, you can get us on Facebook. You can give us a phone call. If you look us up on Google, our phone number pops right up. So that's probably the few easiest ways to get a hold of us.
And we do have a thank you for that answer to the question, Maggie. And I guess the other question I would have for people that are watching, and some places are opening up and doing in-person work. We are starting to do that starting in this month. Are you seeing clients in clinic right now, or are we doing a lot of this virtually?
We are doing a lot over virtual telehealth sessions. However, we are beginning to have our kids coming into the clinic. So we are taking a lot of precautions and we're doing our very best to make sure we're minimizing exposure in every way possible. But we are having kids start to come in for their therapy sessions.
And somebody loves you guys. BDI is the best.
We love you too.
So I appreciate you coming in today and speaking to our families about how they can best support their kids' sensory needs. Maggie, thank you so much. It's been a pleasure to have you and to hear about your strategies.
Great. Thank you for having me. What a
Thank
pleasure.
you for everyone that's tuning in. And we hope you'll watch our upcoming events. We're going to have them posted. We have some additional ones for you to view on behavioral management and support. Thank you for tuning in. Bye-bye.